Hi everyone, Dr. Suneel Dhand, internal medicine physician. Thank you all for all of your kind messages of support following my video earlier this week when I talked about my deplatforming from a major social media website. Just when I thought I was done with deplatforming for the week, the very next morning I received a message from YouTube telling me they had pulled one of my other videos for the same reason, misinformation. This was a completely different video, one where I was going over, again, actual data and encouraging scientific discussion. I have appealed that decision. But it's so interesting, whenever I ask any of these platforms what exactly the misinformation is, they can never tell me what precisely it is. Yet I keep having various different videos and posts pulled and censored. What on earth is going on? And pardon me for thinking that there is some sort of effort going on here to completely shut me down. I've appealed this decision by YouTube. Let's see what happens. For now, I do remain on YouTube. I hope to remain here, but I have got a couple of strikes against me and could disappear at any stage. So please do check out my community on locals.com. The link is down below. Thank you to all of those who have already joined. That is a place, a platform where nobody is censored. It's completely open debate, as we should be having all the time. We have to be moving away from these big tech platforms that think they can arbitrarily decide what is and isn't the right speech and what should and shouldn't be censored. Anyway, I'm still here and I'm going to talk about 3 articles and pieces of news that caught my attention recently. Firstly, let's talk about news from Iceland with regards to the Moderna vaccine. I spoke last week about how Sweden and Denmark had suspended use of the Moderna vaccine, and they did this because of concerns for potential cardiac side effects. They had different age cutoffs in those countries, but interestingly, other Nordic countries soon followed, including Norway and Finland. And last week we had the news that Iceland had gone a step further and completely paused in most age groups the use of the Moderna vaccine. I did hear some news that they may still be giving it in the elderly, but for most age groups it has been paused. What exactly happened then? I have this article here. Iceland on Friday suspended the Moderna COVID vaccine, citing the slight increased risks of cardiac inflammation, going further than its Nordic neighbours, which simply limited use of the jabs. As the supply of Pfizer vaccine is sufficient in the territory, the chief epidemiologist has decided not to use the Moderna vaccine in Iceland, said a statement published on the Health Directorate website. The decision owed to the increased incidence of myocarditis and pericarditis after vaccination with the Moderna vaccine, as well as with vaccination using the Pfizer vaccine, the chief epidemiologist said in a statement. For the past 2 months, Iceland has been administering an additional dose almost exclusively of the Moderna vaccine to Icelanders vaccinated with Johnson & Johnson. As for a plausible reason why the Moderna vaccine may have more side effects than the Pfizer vaccine, as I said last week, the Pfizer vaccine contains 30 micrograms of vaccine ingredient, whereas the Moderna vaccine contains 100 micrograms of the vaccine ingredient. So a big difference there in strength, which is likely reflected in the potency of the vaccine. The second article is one that I read in the British Medical Journal, the BMJ, pertaining to how the vaccination program in England is affecting hospitalizations and deaths. Now, I've seen a lot of statistics come out in the last few weeks, and one thing that I've seen done a few times is people looking at data from January to July and not taking into account the fact that that is when the vaccination program was being rolled out. And also that time period, if we take January and February, for example, would have caught the tail end of the winter peak in deaths that we saw, which was actually happening before we even had COVID-19 vaccines, but that still had an effect in January and February numbers. So this article caught my attention. What effect have higher vaccination rates had on these trends? Sage noted that most patients admitted to hospital with COVID after the 16th of June were fully vaccinated. Public Health England said that even with a highly effective vaccine, this was expected, given the high rate of vaccine uptake and a policy of vaccinating higher risk people first. In its latest surveillance report, Public Health England emphasised that the rate of hospitalizations and death from COVID remained substantially greater in unvaccinated than in vaccinated people. For example, between the week beginning Monday the 16th of August 2021 and the week ending Sunday 12th of September, this is the time period that we want, by the way, because people would have had a chance to be fully vaccinated during the course of the year, as opposed to what I was saying about statistics earlier in the year. But anyway, between the week beginning Monday 16th of August 2021 and the week ending Sunday 12th of September, the rate of hospital admissions of over 80s was 50.5 per 100,000 in the fully vaccinated and 143.9 per 100,000 in the unvaccinated, while deaths were 45.5 and 145.4 per 100,000 respectively. These trends were seen across the board. For example, for 60 to 69-year-olds, the hospital admission rates were 13.5 per 100,000 in the fully vaccinated and 74.3 per 100,000 in the unvaccinated, while deaths were 4.1 and 24.3 per 100,000 respectively. Those numbers are actually very encouraging because, as I've said all along, we have to keep razor sharp focus on the high risk groups. And clearly there you can see in the elderly population, the vaccines are helping to reduce the burden of infection with much lower rates of hospitalizations and deaths in those vaccinated versus those who are not vaccinated. Which patient groups are most at risk after vaccination? In a paper published by the BMJ, researchers at Oxford University reported on a new COVID-19 calculation tool which identifies vaccinated people who are at greatest risk of severe COVID-19 leading to hospitalization or death. Risk groups they highlighted were the immunosuppressed for any reason, including chemotherapy or any other immunosuppressive disease, people with neurological disorders including dementia, care home residents, and people with chronic disease including Down syndrome. So again, these are very well established high-risk groups, and these are the groups that have been first in line to receive COVID-19 vaccines because we want to induce immunity in the high-risk groups first, who are most worst affected by COVID-19 and much more likely to end up in hospital or dying from the illness. The third article that caught my attention was by the American Academy of Pediatrics, and you may remember last week I made a video about childhood obesity and the risk of severe COVID and how the two were intrinsically linked. I also talked about the soaring rates of obesity in childhood, which have sadly gone up even more. It was a problem before COVID, but the last 18 months it's got even worse. Report: COVID pandemic exacerbating obesity risk factors. About 1 in 6 adolescents has obesity, according to a new report. Rates are highest for youths of color and those from low-income homes. Experts say the COVID-19 pandemic is exacerbating the societal conditions that contribute to obesity. Obesity rates were highest for American Indian Alaska Native adolescents, 29%, followed by Black, 24%, Hispanic, 21%, White, 12%, and Asian, 8%. There were significant differences in obesity rates based on household income. Adolescents from homes in the lowest income group had an obesity rate of 23% compared to about 9% for the highest income group. There also were significant gaps between states. Rates were highest in Kentucky, 24%, and lowest in Montana, 10%. Then there was this quote: "Economic stresses, food insecurity, less consistent access to healthy meals at school, combined with increased sedentary time, sleep dysregulation, reduced physical activity, and social isolation have made it harder for families to stay healthy." This is obviously a subject which is very close to my heart as a practitioner of lifestyle medicine, and it is an absolute tragedy that obesity rates, which were already bad among children, have got even worse over the last 18 months. As I said in last week's video, it is going to take a multifaceted approach to solve this. There are no easy answers at all. It is obviously going to need to start right at home with the parents. Everything starts at home, schools, local authorities, even the government, but there are no easy fixes. And I'll leave you now with this one thought. Throughout human history, in fact this rule still applies in poorer nations, being poor and living in poverty was always associated with being thin and being slim. Traditionally, being overweight and obese was associated with having more money. Now, in Western countries, we have had a complete reversal in that trend, where over the last few decades, being poor is associated with more obesity. It's so interesting how this has now reversed. Something to think about there. Thanks everyone for listening. Dr. Suneel Dhand, MedStroke Lifestyle Medicine. Remember to check out my community on locals.com. Link is down below. We'll speak again very soon.